Hey, what's up everybody? I wanted to do a special video today specifically on how to stop active seizures. Epilepsy is very scary, and every seizure type is unique and has a different level of, stress that comes with it. So obviously the tonic-clonic is extremely scary. It can cause a ton of neurological damage and one that needs to be stopped. So there's a lot of options when it comes to how to stop an active seizure, whether it's seizures that are clustering and continuing to go, like complex partials or myoclonic seizures, or even clustering tonic-clonic seizures, or a status episode where these seizures are continuous and won't stop. So whether it's absent seizures, anything, you can have absent status, tonic-clonic status, there's many different types. How do you stop them? It gets so scary when they don't stop. If a tonic-clonic seizure hits the 5-minute point, you're pretty much in status and it's not going to stop. So how do you intervene and get it to stop? There's a lot of different ways, and I want to show you different options that you have, that we all might have, that are very effective. Now, disclaimer, I'm not a doctor, obviously, but I am a dad who's been dealing with this for 10 years almost, and have found a lot of different ways that work, and I want to share them with you. So we'll start with, I'll just talk a little bit. You have pharmaceutical options when it comes to emergency situations and stopping seizures. Diazepam is one, which is rectally administered. Midazolam is another, which is an intranasal spray. Both of those are very strong benzodiazepines. We're going to show you those. The others are alternative methods. So you can use cannabis, and there's different ways to administer. There's transdermally, there's intranasally, there's inhalation, sublingually, or just rubbing it in the mouth, and I'll show you. And you can also use things like essential oils, where you can take something like frankincense and rub it on that upper lip so that the terpenes and flavonoids of the essential oil are going up into the olfactory nerve, causing a signal disruption. That's basically what all of these interventions are going to do, is cause some type of signal disruption to stop that seizure, or it's going to basically put the body to sleep with these pharmaceuticals. And then there's one last one that I'm going to cover at the end that for us has been extremely effective. Over the past few months, I've stopped a couple hundred or more of these seizures instantaneously without any type of drug, any type of substance, just me. And I'll show you that. And again, I'm not a doctor. This is not medical advice. This is just a dad sharing his experience. Before you try any of these things, maybe consult with your neurologist. But of course, the way I want to share is to empower you to be able to make your own decisions. And everything you've done to this point is trial and error. This is just another piece of that to figure out what works for you or your child. So let's take a look at our different options. Okay, so here I am. I've got all these different options here on substances that can help us stop an active seizure. So let's start with pharmaceuticals. For us and our family, these are a very last resort. And I'm glad to say it's something we haven't had to use in a long, long time. So let's say your loved one or your friend or whoever is in an active seizure, it's not stopping, and you know you need to do some type of intervention. Well, you've got two options pharmaceutically: midazolam and diazepam. Now the diazepam, hey buddy, diazepam is rectally administered. So you gotta open up the package, you gotta pull this guy out, make sure it's dialed in. This should automatically be dialed into the right dose for the patient. You gotta pop the top off. You're gonna wanna open this up, administer, lubricate the end, put it in rectally, and you compress and you administer the entire dose of the diazepam. Now, rectally, that's going to absorb quickly, and it will stop the seizure because it's a very strong dose of a benzodiazepine, and you're basically going to be put to sleep. Now, the midazolam is a little easier, especially if you're able to get pre-filled syringe that's the right dose, and an atomizer. This is an atomizer. You just pop the top off of the syringe, screw the atomizer on, and then you follow the dosing instructions. That's very important. In this one, this is a 10 milligrams or 2 mLs, and for Holden that would be half and half in each nostril. So it would be attached, you just shove that up the nose, squirt half in, go to the other side, squirt half in, kind of pinch, get it absorbed intranasally, and it's another similar, it's a benzodiazepine similar to Versed, and that's going to also basically put them to sleep and stop the seizure. So you're drugging the brain to slow down enough to stop that abnormal electrical activity. What are the risks? Well, the reason I say you have to follow the dosing instructions. If you get too much with benzos, they do affect the respiratory system. You want to make sure you're hitting that right dose that's going to stop that abnormal brain activity but keep the patient breathing. Okay, so those are two options you have when it comes to pharmaceuticals. The other thing you could do is essential oils. This is lemongrass. I wouldn't suggest that. But there's certain terpenes and flavonoids and scents that will trigger a signal disruption via the olfactory nerves in the nose. So frankincense is a great one. You could put it on the lip. You could also rub it into the temples and see if you can get the seizure to stop with an essential oil. That's never been too successful for us, but it has worked for other people. Now, all of this over here are cannabis-based options, and these are our go-to, and these are what work. So, and depending on the situation and the seizure type, we're going to do different things. We have topicals. Now, for Holden, he clusters complex partial seizures. They kind of go on and on. What we can do is we can use either a CBD lotion or a CBN, or we sometimes do a combination, but you just get a little bit. And we would just put it right on his temples and rub it in. And just kind of rub it until it gets absorbed. And this will typically absorb pretty quickly. Within a minute or two, it will stop the seizures. The other thing you can do is put it on your wrists, anywhere where you have veins kind of exposed to absorb that transdermally. So this was a Charlotte's Web CBD lotion that we like. We also like Mary's Medicinals. They're gel pens. They're transdermal gel pens. This is a CBN pen, but you can do something similar. You just put some on, and you'll figure out what dose works for you. But you just rub it in, and this can help stop those. So this is for a little bit different.
Dad,
what, Holden?
Is it fine if I use the cat ones?
That's fine. So a little bit of this works great for certain seizure types. If it's tonic-clonic, we're going to want something that works a little bit faster. With spasticity and other issues, we like using CBN orally to get a kind of a stronger dose. So all you have to do is take the oil, and you're going to have to figure out what works best for you. Could be THC, could be THCA, could be CBN, CBD, or more of a complex oil. But you just get some, figure out your dose. For Holden, a good dose for him is 0.4, and it's basically 1 milligram for every 0.1 of ml. So it'd be about 4 milligrams. And we'd squirt it. Typically with a seizure, the mouth is shut, like a locked jaw. You can't get in, so we just shove it into the cheeks, squirt a little in each cheek, and then you're going to get your finger inside and rub it into the gums. Okay, this will get it absorbed quickly. Rub it into the gums and also rub it on the insides of the cheek. And that's actually pretty effective at getting absorbed quickly into the bloodstream and stopping the seizure. There's also intranasal sprays that are cannabis-based. This is a THC. They just came out with a CBD nasal spray. But this one, and there's video of Holden that's been gone around the internet. He was one of the trial patients for this. This works really good. Shove it up the nose, do a spray or two, spray. And each spray is 5 milligrams of THC, so it doesn't take a lot. Plug the nose just kind of like with the midazolam. And again, that's going to hit those olfactory nerves. It's kind of up in the air what's stopping that seizure, whether it's the terpenes that are in that strain or if it's actually the THC. I think it's actually the terpenes that are causing the signal disruption, and then the THC kind of gives that relaxation and recovery and makes the recovery better. And then we have inhalation. So sometimes as his seizures are clustering and we can't get him to stop. Obviously, you're going to already want to have some of this flower. This is a THC strain called Bubba Kush. It's an indica strain. It's really great for relaxation. If you have some already ground up, you just put it inside. This is called the herbalizer, and we have it rigged so that we can run a session, hook up a mask, so that as he's seizing, we can just run it. It's going to turn on. It's going to heat up to the specific temperature, typically around 370 degrees or so, and then you're going to run a session. And once you hit the fan, it will heat up the flower and activate the THC, and then I think it just shut off. There we go. We can just, once the smoke starts coming out, or the vape, just put it right up on his nose while he's seizing, and he's going to be breathing, and that can also help stop the seizure. So a lot of different options. These all work for different scenarios for us. And if you're in a legal state where you can have access to cannabis, man, it's a huge blessing. But I want to show you one other very effective way that you can stop seizures. It's worked for me 90% of the time, and it's instantaneous. And so I want to show you on, we'll probably use Kenzie. So go ahead and stop. And speaking of seizures, we just had one. He's still going a little bit. But I want to say, with the method that I'm just about to show you, I was able to stop it before it went into severe tonic-clonic. So he's still postictal. Okay? But if you can catch a seizure in the beginning stages of it, you can stop it almost instantly. And for the past few months, I've been able to stop at least a few hundred of these from going to severe tonic-clonic, and at least saving his brain from that type of trauma. I'll show you how it works very effectively, at least for Holden. And again, this would have to be something trial and error that you see if it works for you, but I'll show you in a bit. All right, hopefully these cords don't get in the way of what I'm trying to do, but I just recorded the whole video and you couldn't hear me without the mics. So I want to talk to you about how to stop these seizures without some kind of substance intervention. This is mainly going to work for tonic and tonic-clonics. Hopefully it works for us for Holden. It may not work for you. Again, I'm not a doctor. This isn't medical advice. I'm just sharing our experience. Okay, so Holden's seizures happen for the most part at night, during his sleep cycles, as he's falling asleep, randomly throughout the night, and for sure when he's waking up. And for the most part, it's tonics and tonic-clonic. So when he goes tonic, he goes, he streams out, and he just seizes really tight for a while. Minute, 2 minutes, 3 sometimes. But then other times, he'll start tonic and then go into a tonic-clonic. So he'll seize like this, and then just go into a full-on tonic-clonic seizure. Those are very dangerous, and there's a lot of reasons why, both of them. So number one is you're typically not breathing during that entire time, and so the oxygen is, or the brain is not getting the oxygen it needs to be healthy. So you could risk a lot of brain damage. When he's tonic-clonic, it really is a lot of muscle contraction in his gut and triggers him to throw up almost every time. So there's a huge risk of aspiration. It happens actually quite often for him, even though we'll have him on his side. We're doing all we can. And that's what happened to us back in September, right before we moved back to Colorado. He had a tonic-clonic, aspirated. Within a day or two, that had turned into pneumonia. And that pneumonia infection triggered a status epilepsy of tonic-clonic seizures, and we were life flight from St. George to Salt Lake City to the ICU for a couple days until we could get that situation under control.
Maybe you should thank Amy because she watched me and Carter when Holden was at the hospital.
Yeah, and luckily my sister was there to help with the kids while we were, Mandy and Holden got flown to Salt Lake. I had to drive through the night up there. Anyway, once we got here, I had been doing some work with one of our cannabis growers, and we were talking with a neurological specialist. I don't remember his exact specialty, and kind of discussing, how does this intranasal spray work? What are the mechanisms of action? And he wasn't quite sure it was the THC because it works so rapidly that it was most likely the terpenes and the flavonoids triggering signal disruption via the olfactory nerves right to the brain. And he was asking, is there other things you've done that have stopped the seizure? And thinking of some of Holden's absent seizures, if he's kind of stuck in an absent, we could go Holden and just kind of jolt him a little bit and he'd come out of it. And that got me thinking, I wonder if we could stop seizures that way with other seizure types. And so one night he was seizing over and over again, and as soon as he'd go tonic, you go tonic, right? I could grab him, straighten him out, and as soon as I do that, it would stop and he'd relax. Okay? And that would work every time. So if I can catch his seizure within the first 2 or 3 seconds, and he starts to go tense, and I grab him and I pull him straight, and I can sometimes wrap my feet around his legs and just straighten him out, it'll stop like that. I mean instantly. And I've been able to stop over the past few months at least a couple hundred seizures, if not more, this way. And this is huge. This is preventing it from going tonic-clonic. This is reducing the amount of trauma his brain experiences from the electrical storm of the tonic-clonic, from the lack of oxygen, from not being able to breathe the whole time, from the possibility of aspirating. So if he starts even tonic-clonic, it takes a little more effort. I have to wrap in and grab him and keep him straight, and as his head's starting to threat, just hold him still and it'll stop. It just takes a little bit longer. I would say about 90% of the time this has worked. Again, I've stopped hundreds of seizures this way. Every once in a while it's just too severe and it'll go into the full tonic-clonic, and we just kind of go through it, and it takes a couple minutes. But it's worth trying. And this is the opposite of what doctors would tell you. Don't touch the patient. Just make sure they're safe, in a safe place on their side, let the seizure go, and then, assist them through the postictal stage. This is the exact opposite of that. So again, consult with your neurologist or whatever you want to do. I just wanted to share this experience. For us, it works literally almost every time. Instant, just grab them. I straighten them out. I just disrupt whatever the body's trying to do with that seizure, and it stops it. So it's worth a try. Just wanted to share a few things. I've got an exciting announcement for the next video, so stay tuned.